It all starts with an old problem: proteins. The human body has more than 20,000 different proteins, and each one folds into a very specific shape, like molecular origami. And here's the catch. The shape of a protein decides what it does. If it folds the wrong way, it can create diseases. Alzheimer's, misfolded proteins. Parkinson's, misfolded proteins. Many cancers, you guessed it. So scientists had an idea. If we could understand exactly how each protein folds, we could design targeted treatments. The problem? Discovering the 3D shape of a single protein used to take years. Why? Because proteins are insanely complex. A single protein has hundreds of amino acids. Each amino acid can connect in billions of ways. The number of possible combinations? More than the number of atoms in the universe. Scientists spent months, sometimes years, trying to decode one protein. Using X-ray crystallography, electron microscopy, supercomputers. And there was one protein linked to a rare disease that nobody, absolutely nobody, could decode. 30 years of failed attempts, until 2020, when Google DeepMind launched AlphaFold. AlphaFold is an artificial intelligence trained for one mission: to predict the 3D structure of proteins using only their amino acid sequence. Let me translate that. You give the AI the recipe of a protein, like a list of ingredients, and it tells you exactly what the final 3D shape looks like. The result? Insane. AlphaFold predicts protein structures with 90% accuracy. In minutes. Work that once took years, done almost instantly. But it gets even crazier. In 2022, AlphaFold 2 was released. It mapped 200 million protein structures. Basically, every known protein. Free. Available to any scientist in the world. And this leads us to the cure. There's a disease called cystic fibrosis. It damages the lungs, causes constant infections, and drastically reduces life expectancy. It's caused by one defective protein. Scientists tried for 30 years to design a drug that could fix this protein. Thousands of chemical compounds tested. Millions spent. No success. Then in 2024, a research team used AlphaFold. The AI mapped the exact structure of the broken protein. Showed exactly where the error was. And then, the unbelievable part, it suggested the exact type of molecule that could fit into that defective spot, like a key sliding perfectly into a lock. The result? In 3 months, the team created a compound that works 300% better than any previous treatment. Clinical trials started, and the results were mind-blowing. Psych. Patients who lived with only 40% lung capacity began breathing almost normally. Children who spent half the year in hospitals are now living normal lives. All because an AI solved in 3 months what humans couldn't solve in 30 years. And this isn't the only case. Pancreatic cancer, one of the deadliest cancers. 5-year survival rate? Less than 10%. AI analyzed 10,000 proteins, found a specific combination that can be targeted. The clinical trials begin in 2025. Alzheimer's, a disease affecting 50 million people. No cure. Until AI discovered a protein that accumulates in the brain decades before symptoms appear. For the first time in a century, scientists have a real target. Malaria. Kills 600,000 people a year, mostly children. AI scanned millions of chemical compounds and found one that kills the parasite without harming human cells. Human trials are starting now. And it continues. Type 1 diabetes, rare heart diseases, muscular dystrophy, multiple sclerosis. In all these cases, AI is accelerating discoveries that would have taken decades. Scientists estimate that AlphaFold alone has saved more than 1 billion hours of scientific work. 1 billion hours. And the cost. Developing a new drug used to take 10 to 15 years and cost $2.6 billion. With AI, it may drop to 2 to 3 years, at 70% lower cost. How does AI do this? First, data. AlphaFold was trained on every protein structure humans have ever discovered. More than 170,000 proteins. Second, patterns. AI sees patterns humans never could. Microscopic details like, when this amino acid sits next to that one, they always fold this way. Billions of these tiny hidden patterns. Third, deep learning. The neural network has 21 million parameters. It literally learns the physical and chemical laws that govern proteins. Fourth, validation. AI doesn't just predict, it checks, using quantum physics models to verify if the structure makes sense, if it's stable, if it can exist in the real world. And now, AlphaFold 3, released in 2024, doesn't just predict proteins. It predicts how proteins interact with DNA, RNA, drugs, and other molecules. This is opening doors for personalized drugs, gene therapies, hyper-specific vaccines, and treatments tailored to each person's DNA. Some companies are already designing personalized medicine using AI that analyzes each patient's unique proteins. Now imagine the future. 2025. The first medicines discovered entirely by AI reach the market. 2027. AI can model entire organisms, predict how bacteria behave, how viruses mutate. Pandemics stopped before they begin. 2030. Personalized medicine becomes normal. You take a DNA test. AI analyzes your unique protein structure, creates a treatment made just for you, not for the average person, for your biology specifically. And even crazier, AI is starting to create proteins that never existed in nature. Proteins that eat plastic. Proteins that generate clean energy. Proteins that repair human tissue. We're not just studying nature anymore. We are creating new nature. So go back to the beginning. 30 years of human research. 0 results. AI solves the same problem in 3 months. This isn't machines replacing humans. It's machines amplifying humans. The scientists behind that new treatment? They're heroes. They had the idea. They ran the tests. They made it real. AI? It was the tool. The most powerful tool medicine has ever had. And you and I, we're living in the moment this revolution is happening. Right now, as you watch this video, some AI somewhere might be discovering the cure for a disease that affects someone you love. If this story blew your mind, hit that like button. Share this video with someone in healthcare. And tell me in the comments, what disease do you hope AI cures next? I'm Nova, and together we're building a healthier future, one algorithm at a time. See you in the next one.